I'm here with Lenka today, and we're hoping to demonstrate more about NIS in action and show you how it actually works in practice. But I'm going to ask Lenka to describe the symptoms that she's come in with today.
When I walk, actually even when I sit, my leg hurts just here. My lower back hurts almost all the time. And when I'm stressed, which is most of the time, I have to go to the bathroom to pee every half an hour or every hour. I cannot even make one small loop in the woods without jumping off the trail.
Okay, great. So we're going to see if we can find out what's behind these symptoms for her. So I'm going to ask you to lie on your back, Lenka. And we'll start with the muscle test. And again, I'm just going to reiterate that the muscle test is a neurological test. It is not a strength test. So we're looking for this lock response here, which she demonstrates quite nicely. We're going to do a couple tests, and then we're going to start checking some circuitry here. So there. Why don't you touch right here, Lenka? Hold. Why don't you touch up here? Hold. And she's okay there. Could you just put your thumb under your jaw like that? And then I'm going to stimulate a couple points in here and see what, and there it breaks down. So you feel the difference there, yes? Yeah. She says yes. So what this tells me, this test is looking at how the brain controls the firing of the sacral nerves, specifically sacral nerves 1 through 4. Now, it could be one side, it could be both sides, but we're going to check some stuff here. It's interesting giving her symptoms because sacral 1 is specifically associated with the vastus intermedius muscle, which is right here. And this is exactly where she says she's having pain. So if we go in and we just stimulate that muscle, the brain says, I have no idea what's going on there. Let's have you contract the muscles around the bladder for me. This is sacral nerve 2. Sacral nerve 2 primarily controls the detrusor muscle, the muscle that contracts the bladder. Sacral nerve 3 controls the quadratus lumborum muscle. So I could go in, I could just, again, put a little stimulus in there, and her brain just does not, it's not understanding that stimulus. It's stressful to the brain when I do that. Sacral 4 is going to relate to the medial hamstring muscles, the semimembranosus and tendinosus. So she is weak there. So let's demonstrate what this actually looks like so that the patient understands what's going on. So if we have her bend her knee up and we actually test these muscles, put this one down like that. Bring your leg up like this. Now, turn your foot in just a little bit. We're going to try to isolate that intermediate vastus muscle. You push up against my hand. And it's very hard for her to do that. Let's try the other side. Again, bring it up. Turn the foot in. And yeah, she can't. She's got no control over those quad muscles there, that one quad muscle. The quadratus muscles give us lateral stability in the spine. So if we come here and I have her just, I'm going to pull your legs towards the window over here. Ready? You push against me, Lenka. Ready? Hold. She's got no strength. We're going to go the other way. And just, she's working pretty hard, but it's not happening. So turn over on your tummy for me. And bring your leg up like this. Turn your foot out a bit. And we're going to try to isolate the medial hamstrings here. And yeah, she's got no strength on those and no strength there. So this correlates exactly with what she's telling us symptomatically. And that's the beauty of NIS, is that you'll see this all the time, that you can really isolate where the problem is coming from. Could you turn over on your back again? So lift your head up a bit. The next thing we need to do is find out what's going to get the brain back in control of these sacral nerves. So if we have her bring her arm up here, hold for me, good. Okay, there's a couple possibilities here. I'm going to look at one. You touch right here on the ear canal and hold, that's not going to be it. Touch right up here. I'm going to go down here. That shows up weak. What this indicates, if you touch here, what this indicates is that there's some interference in the central nervous system affecting the ability to properly fire these sacral nerves, and that it's related to a cranial nerve. One of the cranial nerves is involved with this. So we want to just check some nerves here. You go here. I'm going to check here. Hold. Hold. And it's cranial 10 that is the vagal nerve is somehow involved with this. I don't know the exact connection yet, but that's what we're going to investigate. So we're going to look at cranial. I'm going to hold the reflex points for cranial 10, which are right here at the base of the skull. Then we're just going to test some other cortical areas in the brain. And again, it's the amygdala. So this corresponds with, remember that she said early, when we talked to her earlier, that she is in a pretty much a constant state of stress and anxiety. And so that fits exactly what we're seeing here. So if you'll go around your ear for me, go to cranial 10. And again, we're just going to get the brain to reconnect, but you wouldn't think that this connection would have anything to do with the sacral nerves, but the body's so much smarter and the brain's so much smarter than I am. So I wouldn't think that, but her body's telling us exactly where the problem is. Now, I couldn't figure that out in a million years, but the brain understands everything that's going on here. So we'll just trust that the brain knows what it's doing, right? So let's look again. Bring your leg up here for me, leg up. Now, just bring it up, like, turn the foot in. We're going to check that medial vast, or the intermediate vast. Now that feels totally strong,
Oh, yeah.
yes?
Oh, yeah.
Let's go here, turn it in. Totally strong. Hold. I'm going to pull your legs towards the window. Push. The other way, push. Contract the bladder muscle again. Good. Turn over on your tummy. I want to check those hamstring muscles. So bend your knee up. Let's turn the foot out and hold. Nice. Let's go here. Out and hold. Now, Lenka, come up. Stand. Tell me, how does it feel? How does it feel on the leg muscles now?
I still have like a pain here.
Still feel a little bit there?
Yeah. Mm-hmm.
Okay. How about your back?
Since I used to have the pain all the time, I think it's a little better.
Good. Yeah, there is a time factor here.
Uh-huh.
So as you move around, I would expect those muscles to start firing better for you. So
less pain?
Less pain. I think you'll also notice that you're having less frequent urination. But the thing that I really want to hear back from you about is whether the anxiety settles down now, okay?
Yeah?
Yeah.
Well.
Yeah. So you let me know about that, please.
Okay.
Okay? Yeah, thank you so much.